Hi, everybody. Welcome to another Chats with Children. I hope you're safe and well. It's Friday. It's wet outside, but my day's going to be brighten up because I'm talking to my good friend, Sanj Kumar, General Manager for ELRIG UK, who's going to give me an update actually on how their event in October now. It seems like years ago, hasn't it? It's October. Drug Discovery 21 went. Was I attended that. It was really good fun. We thought we'd have a wrap up on what the feedback was. So that was one of the first major events in the UK live. Look ahead to next week's event, and you can see the branding right behind you for Flow Cytometry and Imaging, which is in Manchester next week, and get a quick preview of that as well. And look ahead in terms of what the plans are for ELRIG UK for 2022. So first of all, Sanj, how are you, my friend?
I'm all right, Rizwan. Yourself?
Very good, but I'm just disappointed, Sanj. I could not find my Pakistan shirt to put behind me to really dig in how your boys took a hell of a beating. That's what I was going to say. From the
you know what, you guys are great, and the entire Indian community, and I know it, were really disappointed that we lost against Pakistan. But I personally was really pleased afterwards because you guys went on and on and on.
Yeah, well, it wasn't meant to be, but anyway, there's very magnanimous of you to say that. So thank you, Sanj, for saying that. And you can see how you've got to where you are, being so diplomatic. So it's lovely. Anyway, so Drug Discovery 2021, which was in Liverpool, it ran over a couple of days. That was one of the first major events within life science in the UK. So how was the event for you from an organizer's point of view? What were the numbers like in terms of attendees, and what was the feedback from attendees?
I mean, so Rizwan, to my knowledge, it was the first major life science event held face-to-face in the UK in a period of a couple of years or so. And I think, first of all, we were delighted to go back face-to-face. It was, as you know, when the pandemic hit in March 2020, we had to essentially lift all our meetings, create a digital platform, reorganize everything for 2021. So, but we were determined that Drug Discovery 2021 would take place face-to-face, mainly because we just felt that would be better for the community. What we missed in the digital world was the informality and the spontaneity of the face-to-face meeting. But also we believe in the efficacy of the vaccine, and we also believe in the COVID safe measures that we put in place. So to answer your question, we had almost 1,000 people over 2 days, Rizwan. They came in, they listened to about 90 talks in total. Imagine that, 90 talks over 2 days. Those are amazing statistics. And they visited about 100 booths. So we had an exhibition hall with almost 100 booths in there with their vendors as well. So from a delegate perspective, we had nothing but positives. We had some great keynotes like Guido Lanza coming over from San Francisco, Bella Health, Rob Howes from the testing center in Leamington Spa, and then of course a plethora of other presenters throughout the days. And every single room was full. It was full with at least 30 to 40 people, which is the capacity that we're aiming for with COVID safe measures in there. So imagine every single talk, there were 4 tracks going in parallel, and each talk had 30 to 40 people in. So you can do the maths and understand how many people we had in there. So it was extremely well attended. So I think the delegates were very pleased about it. You can certainly tell from the social media presence, Rizwan. If you looked on LinkedIn, it just blew up completely with drug discovery messages. So it was great. I also think the vendors were very happy, so the exhibitors. I'm not going to, you said I was diplomatic, but I have, I've been a vendor all my life, and I've managed sales teams, and the majority were very happy and got good quality leads. You always get a few who say we could have got more, but if you have a salesperson who says they want more leads, that's actually a good thing. They're never going to be satisfied with the number of leads or the engagement they get. So that's just my personal point of view. But in general, they're extremely happy, and again, really happy to be back face to face. The quality of engagement, the quality of interaction was really is so much more fulfilling than the digital format. And the third group are the speakers. Let's not forget about them. How did they feel as well? And again, they were thrilled to be back face to face because they could actually see the audience, interact with the audience. We did actually have a hybrid event, Rizwan. What that means is not every speaker could be there physically.
Sure.
Or for travel reasons, it was still a pain to grab a flight and do a COVID test and blah, 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 and come over. Or their institute that they worked for would not allow them to travel. So we had this really unusual hybrid setup where we had a mix of live speakers and a mix of virtual speakers. And it was seamless, Rizwan. And it just worked really well. We would have a live speaker stand up at the podium, give their talk, and then it would flip over to a virtual speaker who would give their talk. But the virtual speaker could still interact with the audience because there were microphones. They can see the audience because we had a camera in every room, so they could actually talk to the audience as well. So it worked really well. And just one final thing, Rizwan, I will say that Drug Discovery was an absolute success. Drug Discovery 21 was an absolute success. It's all online. If you couldn't make it for whatever reason, go to elrig.org, ELRIG.org, go to past events, go to Drug Discovery 21, click there, and all the talks that we have permission for are now online and available freely.
So Sanj, that's great to hear about Drug Discovery 21. I know that when we spoke at the show, and I've been to other events as well, there still has been a reticence or a difficulty to get Big Pharma to attend a lot of life science and pharma related events due to restrictions internally and travel restrictions. So what was the makeup of the visitors of DD21, and did that have an impact in terms of the people attending?
Yes and no, Rizwan. So there's never ever, you ask a straight question, you never get a straight answer, do you, right? So I'll be, again, very upfront. Just prior to the meeting, we heard a message that unfortunately AstraZeneca, and AstraZeneca is one of the primary pharmaceutical employees within the UK,
sure,
had a restriction in place, therefore they would not be attending the meeting. That caused us a few nerves. GSK said if you have something to do with the meeting, then you can come. So they had a slightly different policy. So we ended up with the day without any AstraZeneca, or very few AstraZeneca employees, depending which department you worked in, attending. And we ended up with a few GSK employees coming and attending the meeting. But of course, the life science industry is much bigger than GSK and AstraZeneca. Forgive me, they're major sponsors of ours, and I don't want to criticize them in any way at all. But there's the UK life science industry is just so vibrant. It's full of small pharma, mid-sized pharma, small pharma, and of course the biotechs. So we actually lump all of those together and we call them industrial. So the actual makeup, now coming to the straight answer to your question, we ended up, and this is what Drug Discovery is all about. This is what ELRIG is all about. We ended up, in our community, we have around about 60 to 70% of our members are from industry. Sure. The contingent that came to Liverpool, the demographics were that 46% of those 1,000 attendees classified themselves as working within industry. So whether it be pharma, mid-size, small size, or biotech, right. 46%. 29% were in academia. But remember, again, in the UK, a lot of drug discovery initiates in academia. So sure. About a third of the people there were from academia. If you then ask them what science people do, around about 40% actually call themselves drug discovery scientists. So that shows us 60% of them are either supporting it or working around it or want to get into drug discovery. And another demographic I'd like to give you, Rizwan, is just that in terms of demographics is that about a third of the attendees are what we call early career professionals. Right. They've just started their career in drug discovery, or they want to go into drug discovery. So that gives you a sense of who attended. And a final statistics, I've got them all in front of me, and why not share them with your audience? Geographically, 73% of the audience was from the UK, 11% from Europe. So we did get people coming in from Europe, and then the rest were from the rest of the world. Right. Okay.
Now you had another event in Manchester the week after that, didn't you, or a couple of weeks after that? So how did that go?
That went really well as well. We had you're going to have to pause it again. There we go. Yeah, that went really well as well. And again, this was surprising because it was 2 weeks after. But I think Discovery Technologies is a very interesting one because it's novel technologies just coming into the drug discovery arena. And it was held on the Bruntwood Science Park, the Alderley Edge Science Park in Alderley Park and Alderley Edge. We had over 164 to be precise who attended, and that was 2 tracks over 2 days with similar demographics in terms of who attended.
Right.
That went very well as well. Cool. But it was expected to be a smaller meeting as well.
Sure, of course it was.
It wasn't a drug discovery.
Right. Now you've got your event coming up next week.
Correct.
On flow cytometry and imaging. So what can people expect to see there? And, you know, what do you think are some of the highlights that people can look out for? And also, just to point out to people that it's free to attend, so you can still register as well.
Correct. It's all free to attend. Everything that ELRIG does is free to attend. So our business model is very much about selling sponsorship at the meetings, and we have a very loyal exhibitor base who come and support us, and we're very grateful to those. We're expecting about 150 people again next week, Rizwan. So we have 210 registered. 212 registered this morning, but there's always a drop off.
Of course, sure.
Because we're free of charge to attend. So we'll end up with about 150 people there. We have around about 15 exhibitors who are going to be there as well. And it's all about flow cytometry and imaging and the technologies associated with them in the drug discovery world. Traditionally, this meeting has been held on in the GSK campus down in Stevenage. GSK hasn't quite opened up its site yet to visitors, so we've moved it up to Manchester, a place called Circle Square, which is right in the heart of Manchester. And our thanks to Bruntwood for supporting us and providing that space again. So it's a brand new facility. We're looking forward to seeing how the meeting goes. We'll see, you know, we'll lose some people because it's not in GSK, but we'll gain some people because it's in Manchester. So swings and roundabouts. But this is all about the technologies of pharmaceutical, this is all about the technologies, flow cytometry technologies and imaging. And we've got 3 tracks, Rizwan: translational flow cytometry and imaging in drug discovery and development, novel and emerging technologies in flow cytometry and imaging, and the next era in multiomics and spatial cytometry as well. So really exciting meeting next week, Rizwan.
Brilliant. And looking ahead now for 2022, I mean, I know obviously Europe is now looking like you might go back into lockdown again because everything is, so it must be very difficult for you as an organizer to be looking ahead and planning. So what's your personal view then looking at 2022, and what's ELRIG's plans for 2022? I know, if anything, the pandemic's taught all event organizers, I think, and then everybody not to plan too far ahead or have some contingencies in place because you never know what's going to happen.
Yeah, the challenge with conference organization is you do have to plan event because you've got to book the venues, you've got to put marketing in place, you've got to get speakers lined up. So you have to plan ahead. So we have a plan for 2022. The point is to have a contingency if anything changes. So we actually have 15 events next year, Rizwan, of which 7 are what we call a tier 1 event, which are face-to-face conferences, and 8 are networkings, which will take place, and they're much smaller. So we have CRISPR and drug discovery taking place in March in Babraham, research and innovation taking place in March in Oxford, advances in cell-based screening taking place in AstraZeneca and Gothenburg in May, translating ideas into therapies taking place in the CRIC in July, Drug Discovery 22 in Excel in London. Everybody should come to that one. It'll be a blockbuster event. Protein Sciences and Drug Discovery 2022 in AstraZeneca in Cambridge, and Robotics and Automation 2022 in the Festo site in Stuttgart in November late next year. We are planning for all of those to go face-to-face. But in the background, if we can't, then we have a digital capability and we can very quickly switch those meetings to digital. We have a little leaflet that you can download from elrig.org. I'll give the link to you, Rizwan, so you can pass it on to your listeners. And you can on there you can see all the tier 1 events, And on the back, you can see all the tier 2 events, which are the network. Sorry about the background.
No, that's fine. Yeah, I'll add it onto my events list as well. That's brilliant. So, Sanj, from your perspective, what's your predictions for 2022 then in terms of life science? What exciting things do you think are likely to happen for next year?
I think life sciences is going to boom next year in all aspects. I have a very narrow focus, which is drug discovery, Rizwan, and of course there was a huge downside to the pandemic in terms of people and families being affected by a very virulent disease. Effects on economies and political ramifications that will resonate for years and years and years. But on the other side of that, the area that came out shining, in my opinion, is the life science industry. It was suddenly realized that if we put a focus on something, if we take advantage of all the new technologies that are out there, if we look at all the great advances in science that have happened, we can actually manage situations and respond to situations like a pandemic. So I think there'll be continuing drive of exponential growth in the life science industry in all areas. I think it'll continue to be very much more applied than theoretical, so very much more therapeutic and medicinally based.
Sure.
But that's been a trend that's been happening for dozens of years. I don't think there will be any one particular technology or application that will be a great driver, but I do think all the exciting areas that were lacking from funding will suddenly find themselves, actually, if we can invest now because of what we've learned from the pandemic, perhaps this area will get a return on our investment. So we'll just see a massive uplift in that. I think was
brilliant. And one final question was, I just remembered, you have also gone into a partnership with SLAS, haven't you?
Correct.
So what does that partnership entail then, and how does it work?
Yeah, SLAS and ELRIG have a memorandum of understanding, which means we're going to do joint activities together next year. So, for example, I've actually yesterday booked my ticket to Boston. I'm off to Boston to the SLAS meeting.
Hopefully I will be as well, but I'm not doing it as early as you. I normally leave it to the last.
Oh, I'm not like that. I'm the guy who always drives on a full tank of petrol as well. And take your coat because it'll be cold in Boston. But yes, so I'll be visiting Boston. Equally, I'm sure Vicky and her team will come over to our meetings as well. We have 4 activities that we're doing together next year, and I will give you the dates. Let me turn this over. So one of the activities is a joint networking which is taking place in Novartis in Basel in Switzerland in June. So we're going to be working together with SLS on a topic called protein degradation, and putting together a workshop in that. There's also, we're going to be providing a track in their Dublin SLAS Europe meeting, which is also in June as well. But they'll also be giving us a track as well as working with us on our innovation zone in Drug Discovery 2022.
Sure.
So we made the press release announcement last year, but we'll put real detail around all those activities a little bit later on.
Brilliant. Well, Sanj, all that's definitely say is thanks very much, mate. Enjoy the weekend, and hopefully it stops raining in Birmingham for you. And I look forward to seeing you next week in Manchester.
Yes, look forward to it. It's fine. You take care.
All right, there you go, viewers. Well, if you'd like to know more about ELRIG in general, or in particular Flow Cytometry and Imaging event, which is next week, you only need to go to elrig.org. All the events are on there. It's very easy. You can click on it, and it's very simple to register as well. So if you are interested in attending, you can still do that right up to the day and still turn up and come to the event. It's free of charge, as Sanj has already mentioned. And you can also see the whole program for the rest of the year as well, and into next year as well. So Sanj, lovely to see you again, mate. I look forward to seeing you next week, and take care.
Cheers, Rizwan. Take care. Bye-bye.
And thank you, viewers. Until next time, as always, stay well and stay safe. Bye-bye.